How can we manage type 2 diabetes effectively, you may ask? The answer lies in the importance of a healthy diet and regular exercise, careful monitoring of blood sugar levels, and taking prescribed medications. It's also crucial to seek regular medical checkups and garner support from healthcare professionals. Welcome to Health Pulse Update, your guide to staying informed and maintaining a healthy lifestyle. I'm Dr. Athar, and today we're exploring these key fundamentals for managing type 2 diabetes. Type 2 diabetes management hinges on several factors: controlling blood sugar levels, dietary modifications, lifestyle adjustments, and medications. The goal is to create a personalized treatment plan which includes healthy eating, weight management, physical activity, and smoking cessation, devised in collaboration with a healthcare provider. Lifestyle changes, along with medication, are pivotal in improving overall health. Metformin is usually the initial medication for most individuals with type 2 diabetes. But how do you know if the treatment is working? Your doctor can help answer this by conducting a blood test known as an HbA1c. This test reveals your blood sugar level over the past 2 to 3 months. Another way to gauge the effectiveness of your treatment is to monitor your blood sugar level independently. While not everyone with type 2 diabetes needs to do this, some might find it beneficial. It typically involves using a device called a blood glucose monitor. If your doctor recommends this, they will provide detailed instructions on how and when to use the device. If your blood sugar level remains higher than normal after taking metformin for 2 to 3 months, your doctor might suggest increasing your dose or adding a second medicine. This could be another daily pill or a shot that you administer to yourself once a day or once a week. The choice of medication depends on various factors, including your blood sugar level, weight, other health problems, and comfort level with self-injection. Some medications may induce low blood sugar, leading to symptoms like sweating, shaking, hunger, and anxiety. Immediate treatment is essential to prevent unconsciousness. For some individuals, insulin may be part of the treatment plan. Insulin is a hormone that helps sugar get into your body's cells. In people with type 2 diabetes, the body doesn't respond to insulin normally, and over time, the pancreas stops making enough insulin. Insulin might be prescribed as a second medicine or as the only medicine. It usually comes as a shot that people give themselves. Regular checkups every 3 to 4 months or longer if well controlled involve discussions about medication and blood sugar levels. Adjustments to the treatment plan may be made if necessary. Managing diabetes can be challenging, and maintaining emotional well-being is crucial. Always inform your healthcare provider if you encounter difficulties so they can provide appropriate support. In summary, managing type 2 diabetes involves controlling blood sugar levels, making lifestyle changes, and taking prescribed medications. Regular checkups and open communication with your healthcare provider are also essential. It's a journey, but with the right plan and support, it is manageable. Stay informed, stay healthy, and remember, you're not alone in this. Thanks for tuning in to Health Pulse Update. I'm Dr. Athar, signing off.